TMS and grief. I personally, this one is kind of my question. How is it that TMS is helping with grief?
When I talk to my patients who've never experienced depression, I said, have you ever lost somebody you love? You know, and there's grief, and you know what that feels like. The difference that I find between depression and grief is there's a lot of self-blame. And Freud actually talked about this back in 1912. He wrote this seminal paper on mourning and melancholia, where he talked about depression is anger turns inward. If you have complicated grief and mixed feelings towards the person that you love, you feel guilty about it, and you feel a lot of self-recrimination. And that self-recrimination can be internalized. And when it's internalized, you can get depressed. Now, back in 2013, the American Psychiatric Association took away the bereavement exclusion for major depressive disorder. So if you meet the criteria for major depressive disorder, which is a 2-week period of time of down, depressed, sad mood with sleep disturbance, appetite disturbance, difficulty concentrating, difficulty making decisions, memory difficulties, a low self-esteem, guilt feelings, and suicidal ideation, if it's caused by grief, you're still depressed.
Yes.
And if you're still depressed, TMS will work.
Yes.
Now, so that's how TMS can really be effective even in a grieving process. Now, I would say if somebody's only 2 weeks into their grieving process, I'm not going to say, oh yeah, go do TMS. You know, because sometimes you have to go through your normal period of grief. But if it's 2 months, 3 months, 4 months later, and you're still depressed and mourning and grief-stricken, TMS will work and will be effective for you.
Thank you for that. Thank you for that. If you guys found the information in this video helpful, do yourself a favor. Click on this video right here.
Seriously, click on this video. Click on this video.